Hi, everyone. Thank you for joining our presentation. My name is Jasmine Delgado Bilbe, and my classmates Trelisa Davis and Margaret Arthur will be providing information regarding the maternal mortality rate in Yemen. So, an estimated report from the World Health Organization revealed that there were 287,000 maternal deaths due to complications of pregnancy and childbirth in 2020, which was only a slight decline from the recorded 309,000 in 2016. Although slow progress was made between 2000 and 2015, these modest progressions have now stopped and in some cases have backtracked in recent years. Yemen is one of the poorest countries in the Middle East. It is suffering from poverty, illiteracy, unemployment, a poor infrastructure, and a civil war. Maternal health is one of the primary problems facing Yemen's healthcare system, along with numerous other issues. The nation is categorized as one of the highest rates of maternal mortality and preventable diseases due to its high rate of poverty, prolonged civil conflict, and inadequate healthcare system. According to the World Health Organization, in 2020, the MMR was 183 deaths per 100,000 live births. The lack of access to clean water, wholesome food, and proper sanitation is a result of widespread poverty, which also makes it very difficult to receive essential pharmaceuticals, professional medical staff, and basic healthcare services. Also, cultural practices such as underage marriage, which increase the likelihood of pregnancy and childbirth complications, malnutrition, weaker immune systems, and an increased risk of disease, exacerbate these challenges. To address this issue, an approach that tackles poverty, restores the healthcare system, provides peacemaking operations a top priority, and empowers women via education and better access to high quality maternity healthcare services is needed. Next, we will have Jolisa Davis going over prevention approaches. And to close it out, my colleague Margaret Arthur will provide the challenges and recommendations along with the conclusions. Thank you for joining, and we appreciate you.
Hello, everyone. Today, we'll be discussing prevention approaches for the complex issue of maternal mortality in Yemen. We'll be exploring key approaches to address this critical challenge. The Yemeni crisis presents multiple obstacles that must be tackled collectively and comprehensively to prevent maternal mortality. Let's examine 5 key approaches to achieve this critical objective. First, we should focus on improving access to maternal health care services. This involves increasing access to prenatal care and access to skilled birth attendants. According to UNFPA, 84% of births take place at home, and only 27% have skilled birth attendants present. We should also focus on improving the health system's infrastructure in Yemen, which is currently fragile and unstable due to long and ongoing civil conflict. Additionally, focus should be placed on facilities having plentiful resources and being sufficiently staffed. This can be accomplished by training additional medical staff, similar to the efforts of the SHARP project, which trained 862 certified midwives as frontline workers. The second approach is promoting maternal health education through community-based education programs. This will foster awareness about maternal health issues, contraception, and skilled birth attendance. Focus should also be placed on educating women regarding pregnancy complications and what signs they should look for to help with early detection and speed up the decision to seek medical care when necessary. Third, we should also address the socioeconomic factors that contribute to maternal mortality. We should implement interventions to reduce poverty and mitigate economic barriers that impede on proper healthcare access. There should also be support for policies that promote women's education, economic empowerment, and decision-making autonomy for women. The fourth approach involves strengthening health systems and governance through increasing the knowledge of healthcare providers with training programs for midwives, nurses, and doctors. We should also focus on strengthening health information systems to track maternal health indicators and improve accountability, similar to the efforts of the SHARP project, which evaluated and improved the health management information system in Yemen. Lastly, we should focus on conflict mitigation and humanitarian support. This can be done through encouraging peace-building initiatives to alleviate the impact of the ongoing conflict on maternal health facilities. Also, we should incorporate maternal health elements into all humanitarian aid efforts. Addressing maternal mortality in Yemen requires a multifaceted approach, and by capitalizing on health-seeking behaviors and strengthening the health system infrastructure, we can accomplish this. If we implement these strategies, we can work towards improving maternal health outcomes and saving lives. Thank you. Now, I'll hand it over to my colleague, Margaret.
Now, moving on to the challenges. One of the biggest challenges Yemen faces in tackling maternal mortality is insufficient funding. So, due to the conflict in Yemen, resources are incredibly very scarce, and many organizations have been forced to withdraw or limit their support. This lack of funding has led to the closure of health facilities, shortage of essential medical supplies, which directly has affected the availability and quality of maternal care in Yemen. Secondly, the ongoing conflict in Yemen has damaged most of their healthcare infrastructures. Many healthcare facilities have been destroyed or left non-functional, making them inaccessible. So this lack of access to proper healthcare, especially in rural areas, has posed a significant challenge in providing quality maternal care in Yemen. Lastly, women living in poverty often lack access to nutritious food, clean water, and sanitation, making them vulnerable to pregnancy complications. Additionally, these financial constraints or poverty in Yemen can prevent them from seeking medical care on time, further increasing their risk. So, in order to address this funding crisis in Yemen, the international community should prioritize humanitarian aid, which is directed towards strengthening Yemen's healthcare system, particularly in the maternal health services. Also, while rebuilding is crucial, a long-term goal, and a very more immediate recommendation will be to support the establishment and operation of mobile healthcare crises. The mobile units can reach women in remote areas and provide essential maternal healthcare services, bridging the gap caused by these damaged infrastructures. Another initiative to implement is to expand financial assistance programs specifically for pregnant women and new mothers. This could include covering transportation costs to the health facilities, subsidizing essential medical costs and nutritional foods, and providing stipends to offset lost income during pregnancy and then during postpartum care. So this targeted approach can ease immediate financial burdens and also improve access to life and quality maternal care. In conclusion, the high maternal mortality rate in Yemen is a consequence of conflict, poverty, the shattered healthcare system. However, by working together, the Yemen governments, international organizations, and then local communities can create a long-lasting change and together can build a healthier future for mothers and children in Yemen. Thank you for your time and attention. And if you have any questions, please link us through our provided email address. Thank you.